The Chief Executive Officer of the Institute of Human Virology of Nigeria, Dr. Patrick Dakum, has commended the federal government in its effort to care for HIV patients in Nigeria through the establishment of trust fund.
I think it's a very good thing that the government is establishing a trust fund that will go ahead in beefing up the plans for sustainability of caring for HIV in Nigeria, HIV patients in Nigeria. First of all, there's no country that should be depending on donors to keep its citizens alive. I think that's the first premise. We must not be dependent on donors to keep our citizens alive. And if there are over 1 million people that are on treatment, those people need to continue on treatment. Who is going to pay the bill? So I think the president, in taking an initiative to establish a fund, is really a step in the right direction to enable now government begin to take ownership and to own the program. Currently, the government of Nigeria has taken steps, and 2 states, Abia and Taraba, are funded by government completely for HIV/AIDS, while we have the other states are being supported by donor agencies. Principally, we have the US government through PEPFAR and also through the Global Fund. There are a few others. Now, clearly, at some point, donors will have to go. And if they are going to go, what are you going to do? And I think the process of a gradual takeover of the program is a better strategic process than for us to wait until a point in time and then we now get lost in the whole activity. So for me, I think the trust fund is good. I do know that, you know, the commitment to put a minimum of 50,000 people on treatment every year had been made by the government of Nigeria. So if the government of Nigeria will do that, I believe that it is kudos to them. Well, of course, the challenges are in the fact that, you see, if you have, if your need is 100 naira and you get 5 naira, you will say thank you, but the journey is still long ahead. So far, I think the proportion of people that are being taken care of by the Nigerian government is not yet up to 20%. It means there's a long way to go. But a long journey starts with a step, you know.
Dakum also said the Institute of Human Virology of Nigeria, Rivers State Government, and Center for Disease Control and Prevention will partner to strengthen the diagnostic capacity of Rivers State, which will present them with the viral load.
In Port Harcourt, what we have been asked to do and we are funded to do is principally to work along with the government of Rivers State with the technical support of CDC. We are going to be carrying out, first of all, identifying all the facilities that do not have HIV diagnostic and treatment capabilities. But 2, we are not going to be limited to the facilities. We will also be working in going to the communities to ensure that in these communities we identify high-risk groups, we identify people that we believe are communities that the prevalence is much higher, and then we place those people on treatment once we find them. Yes, we are going to be strengthening the diagnostic capacity in Rivers. We are going to be looking at what their molecular diagnostic capacity is, that is the ability to be able to do the viral load, and working with our funding agencies will be seeing what best to do to ensure that the services are provided. So it will be a flurry of activities. We have currently gone to Rivers State. The partner that was supporting Rivers State before, that is handing over to us to continue. We have worked collaboratively with them. We have met with the Commissioner of Health in Rivers State. We have met with all the key stakeholders in Rivers State. That is the State AIDS Coordinating Program, the State's Agency for the Control of AIDS, and also with the primary health care team in Rivers. We have also had meetings with the teaching hospital in Port Harcourt, because you know, the care for HIV we want to institutionalize, in the sense that when you are sick, you go to your nearest clinic. Sometimes some people go to chemist. We're going to use chemist too. Then if it's not giving you the results, or you're not getting better, you go to the higher, and to the highest. And the University of Port Harcourt and the Brightweight Teaching Hospital are the tertiary centers we'll be working with.